Good afternoon, and thank you for joining us. We join today in what is a very special week during some extraordinary times. Christmas is Friday, and it's a time for many of us to celebrate their faith and gather with family and friends. However, we cannot ignore the reality that we are in a bad place right now, with COVID-19 cases continuing to rise, and hospitals are straining to treat patients and provide enough intensive care units and beds for the sickest in our region. Because of that, we want to make a special plea to all out there to avoid large gatherings with people outside your immediate family. We know that's a lot to ask at this time of the year. We know that it would disrupt treasured family traditions and that many of you have not seen other family members in some period of time. We ask for your cooperation, though, this one time, this one year. I'm sure many of you are thinking that you've been tested recently and that you're okay, or that you had a plan for a safe gathering. But as we've seen, many of the cases from the recent surge came from people who gathered for Thanksgiving. Getting together for holidays is simply too risky this year. The vaccines are arriving, and we can see the end in sight of this pandemic and realize that, maybe this is the year to forego some of the traditional Christmas celebrations and look forward to next year. If it's too late, if you've already traveled and are at your family's home, please be extra careful and take extra precautions. But again, if you can avoid it, if you can just hold off on that gathering for the holidays this year, we would ask you to please do so. So on the night before Christmas, please make sure that all through the house, not a creature is stirring, not even you know the rest of the story. We do want to let you know that if you are not traveling and are in San Diego this weekend, our testing sites are remaining open for people who need tests. You see a slide coming up now which tells you that on December 24th, Christmas Eve, that's tomorrow, all sites will close at 4 p.m., and that'll be true on December 31st also. On December 25th, USD, San Marcos, and the southeastern San Diego facility at Tubman Chavez will be open from 10:30 a.m. until 2:30 p.m. If you have any questions, please call 211 or visit 211sandiego.org. We will proceed with our updates, starting with Supervisor Nathan Fletcher and then Dr. Wooten. And today we have a very special guest joining us, Chris Van Gorder, who is the CEO of Scripps Health, who will talk about our hospitals and how they are coping with the new surge in cases. Now please welcome Supervisor Fletcher.
Good afternoon. As we head into the Christmas holiday, we're faced with confronting the stark reality that this is the darkest hour and darkest time we faced throughout our duration of COVID. Our cases, our hospitalizations, ICU utilization, all those numbers continue to head in the wrong direction. Thanksgiving coincided with the time of increased spread of COVID-19, and then, frankly, folks made a lot of bad decisions at Thanksgiving. At a time of increased spread, those gatherings triggered a wildfire of COVID that is raging throughout our community today, and that is what is impacting our hospital systems. And the choices that we make over the course of the next 3 to 4 days will determine our trajectory for January and where we go. Around the holidays, I know you gather with your family because you love them. At least the majority of them you gather with, you love. But you gather with them because you love them and you care and you enjoy each other's company. And this year we're asking folks to do something that's counter to everything we normally do. We're asking you to not gather with them because you love them and because you care about them and because you care about one another, a broader family that is our community. It's each and every one of us, because you care about that nurse and that doctor and that senior citizen, because you care about that small business. We're not going to be in a position of getting things open again until we get the cases under control, because we care about one another. And so this holiday season, we are asking folks, not forever, just this one. We have to find a way to come together and avoid the continuation of the spread. When you look at the number of cases across San Diego County, thousands of cases every single day. You look at the probability that someone has it. You look at the reality of what we know of indoor transmission, and it's just simply not a risk worth taking. And it is in part an act of service that we do to one another to come together. The hospitals in San Diego County are nearing their breaking point. They're exhausted, they're tired, they're overworked. You're going to hear from Chris in a few minutes about what frontline workers are going through and what they're facing. We know on the state numbers, the ICU bed capacity in Southern California right now is at 0. We see what's happening in Imperial County, where they're having to make crisis care situations because they are out of space and out of beds. And we're going to continue to work to do everything we can. You see what's happening with hospitals, with ambulance diversions. You see them requesting ventilators from our stockpile at the county, and we're happy to provide those. Today, the governor announced the federal medical station at Palomar Medical Center is going to be activated. It's a developing situation. We'll share more information as we get it, but we're doing everything that we can to address the impact of the transmission of COVID. But each and every one of us now need to do everything we can to impact the situation our hospitals face. And that's what we do by slowing the spread and by coming together. We are also continuing again to see an uptick in deaths in our county and deaths nationally. The death toll has been around 3,000 a day. That is more than the number of deaths from September 11th attacks, but it's happening every single day in our country. And we know here in San Diego, we are seeing an increase. It wasn't that long ago. We were in the hundreds. We've seen a significant jump. And again, that's just a reminder to each and every one of us about the severity of the situation we face and the actions that each and every one of us may take. And so we are pleading with you as we head into this very challenging time. Let's get through this. Let's get out of this. Let's start focusing on lowering those numbers and vaccine distributions and our planning for rebuilding and recovering. But we have to face the situation in front of us today. I'm going to strip down the charts we're doing today in the interest of time. All of the information will be fully available online. I do want to share our testing numbers continue to be strong. Our 7-day average of testing is more than 25,000, almost 26,000 tests. 25,806 is our 7-day average. And as you'll see right here, we continue to keep up our turnaround times. And this is a great testament to our partners, our hospital partners, our Helix partnership, our public health, the state walk-in labs, our friends at the FQHCs, commercial labs. Again, you remember before when we had a surge, these shot up significantly, and we continue to do well there. But our 7-day average of testing is 25,806. And again, this is helping us as we go through this. And we ask for patience for everyone. Having to wait in a little bit of a line, work to get an appointment. We're going to continue to make sure testing is available. The next chart you'll see right here is just the hospitalizations, and this just paints a picture of what we faced. And if it went off further, you would see when those numbers were much lower. But again, this is not a good trend. It's only going in one direction, and it's only going up. And what's happening is these are just COVID-related hospitalizations. The COVID ICUs on the bottom, the non-COVID or non-ICU COVID patients at the top. This is crowding out other folks who need care out of our system, and you'll see that represented here on the ICU capacity. So as you see here, what we're looking at as it relates to ICUs, that blue number continues to grow, the orange number continues to shrink. That orange number is non-COVID folks in ICUs. These are the procedures that are being delayed. These are surgeries that are being canceled. These are cancer patients that aren't having their tumors removed. These are folks that are being told, hey, you know what, there's no room for you here. You're going to have to wait. And so the health of every San Diegan is being impacted by the inability of us to control the spread of COVID, and we continue to see this increase. I also want to point out that today, although you see the current ICU bed capacity number there, and many folks will say, well, everything's fine, a bed by itself does not treat you. It needs to be staffed. And we don't know that we could get to fully staffing that. And all of the effort that we can do around setting up tents and standing up centers, again, relies on that need for staffing. And our staff are tired, they're getting sick, they are burning out, they're being deployed to other areas, and this is a challenge. As of today, we had 33 staffed and available ICU beds in San Diego County, 33 in a county of 3.4 million. And so again, this paints the very concerning picture. we face and why we all, again, have to come together to slow the spread. So with that, let me turn it over to Dr. Wooten, and then we will hear from Chris Van Gorder from Scripps. And again, we wish you all the very best holiday season. We hope it is pleasant and enjoyable. We also hope that we do it safely. Dr. Wooten?
Thank you, Supervisor Fletcher. Before sharing the latest COVID-19 statistics, I want to share with everyone how difficult this time of year is for so many of us. The holidays are supposed to be a time when we get together with family and friends, and unfortunately this year, things will be different. Many people are tired of the pandemic, we are certainly aware of that, and tired of being separated from family and friends. However, households must continue to stay apart from others to get the spread or to decrease the spread of the virus and to get it under control. If we don't, cases and deaths will continue to soar as they have in the past weeks. It has been 10 months since the county declared the local health emergency as well as a local emergency on February 14th. As cases have increased over time during holidays, we see a surge. We saw this during the 4th of July holiday, and now we definitely have seen the results of Thanksgiving, the Thanksgiving holiday. In this next slide, I want to share with you just what the numbers have looked like over the past days and weeks. The 3 weeks after Thanksgiving were especially difficult, and COVID-19 cases have skyrocketed. Exactly 21 days after Thanksgiving, San Diego County had its record high number of cases at 3,611 on December 17th. In the next slide, this graph is an example of how a local Thanksgiving event became an exposure super spreader event, resulting in additional cases. And this is an actual situation. There were 6 households that gathered together consisting of over 20 people of different ages. One person who attended, as shown in the yellow circle, was just beginning to develop symptoms and got tested after this event and was found to be positive for COVID-19. But it was too late. Within a week's time, 4 additional persons from 3 of the households who attended this Thanksgiving gathering became positive. Now in the next slide, our EPI staff have put together some statistics to really further drive home the impact of the Thanksgiving holiday. Over 44%, which is 59,394 of the approximate total of 135 individuals, and this is data as of the 23rd, were confirmed after Thanksgiving, and this was from December 27th, from December November 27th through December 15th. In addition, 1 in 162, approximately 162 San Diego residents were reported positive for COVID-19 in the past 7 days. And currently, San Diego has reached 134,696 cases, with 2,598 reported today. Of the 5,524 hospitalizations, about 773, or 14%, took place after Thanksgiving. And of those that have died, the 1,350 reported, about 334, or 25%, happened after Thanksgiving. Now, at the pace deaths are growing, our county is on track to record 600 more deaths by the end of January 2021. We don't want to see what happened and has happened after the Thanksgiving holiday happen after Christmas. And this will result in another surge in local cases. As stated, today's case count is 134,696 cases, which is 2,598 more cases than yesterday. And the demographics have essentially unchanged. The age range is from 0 to 107 years of age. The median age for cases is 34 years of age. And the age groups 20 to 49 years of age represent 56% of the total number of cases. Gender percentages have not changed. And the total number of hospitalized cases represent 4% of all cases, and those that have died represent 1%. Going back to the hospitalizations, of those that have been hospitalized, ICU cases represent 1% of all cases and 21% of all those hospitalized. And CEO and President of Scripps Health will talk further about hospitalizations in our local healthcare system. So as we move to the next slide, we're going to talk about outbreaks, and these are our community setting outbreaks in the past 7 days. We are reporting 44 total community outbreaks from December 16th to December 22nd, representing a total of 164 cases. We've seen a significant decrease in the number of community outbreaks in the past couple of weeks, but still above the threshold for this particular metric. So going to the next slide, this will show the number of the 12 additional outbreaks that were reported since yesterday. Can you go back, or did we miss that? It's not included. So I'll just read it off. So of the 12 additional outbreaks reported from yesterday, 3 are in businesses, 2 are in kindergarten through 12th grade, 1 is in a construction setting, 1 in a daycare, preschool, or childcare setting, 1 in an elementary, or rather 1 in an emergency services setting, 1 is in a food, beverage, or processing setting, there's 1 in government setting and a grocery setting, and then lastly 1 in a healthcare setting. So the next slide is a summary of all outbreaks, and we have 3 primary categories: skilled nursing facilities, non-skilled nursing facilities or congregate settings, and then community setting locations. And just briefly here, the total number of cases in skilled nursing facilities and non-skilled nursing facilities and other congregate settings, as well as community settings, make up just over 10% of all cases and 33% of total deaths, with the total deaths being primarily in SNFs and non-SNF congregate settings. Going to the next slide, let's move on to the regional stay-at-home order. So on December 6th, the regional stay-at-home order went into effect for Southern California, and there are 5 regions. These are health officer regions. And as you will see, most of the Southern California and Central California have been issued a regional stay-at-home order. And these, as it states here, is in 3 of the 5. So San Diego is under the Southern California region, and our ICU capacity remains at 0.0%. It has been almost 3 weeks since the stay-at-home order for Southern California went into effect, and the situation has not significantly improved, and things are obviously, therefore, not getting better. The regional stay-at-home order will remain in place until the region has an ICU bed capability or availability above 15%. Going on to the next slide, I want to just leave you with a brief update on our local COVID-19 vaccination efforts. We are now 9 days out from receiving our first vaccines in San Diego County. There are 2 vaccines that now have currently been approved by the FDA and with recommendations approved by the Centers for Disease Control and its advisory committee on immunization practices. Pfizer and Moderna vaccines are roughly equally effective, with 95% efficacy for Pfizer and 94.5% for Moderna. The storage capacity, people may be aware that Pfizer requires an ultra-low temperature freezer at 70 degrees Celsius and 94 degrees Fahrenheit. For Moderna, a refrigerator is required, so that makes it better for local small practices and other federally qualified health centers when it is time for them to order their vaccines, and any of our smaller hospitals to have the capacity to store and appropriately manage the vaccine. Vaccinations are a bit different for Pfizer. It's a 2-dose series for both. For Pfizer, you are administered the second vaccination 21 days after the first, and for Moderna, it is 28 days after the first vaccination. And in the last column there, we have the number of vaccines that to date are in our region, but these numbers do not include the military supplies or military supplies of vaccines, do not include multi-county entities such as Kaiser or our pharmacy partnership program. So in order for a healthcare facility to receive vaccines, the organization must be enrolled and approved through the Centers for Disease Control and Prevention COVID-ready platform. So that's very important as our staff, well, CDC, or rather not CDC, but CDPH has sent out instructions and will continue to do that. Our local immunization program staff will send out instructions. So as people get those instructions, what I am asking you to do is just make sure that you are registered in the COVID-ready platform so that when it is time for you to trigger or submit or rather get your vaccinations, you are already registered. CDC will not distribute vaccines unless providers and our healthcare systems are registered in this system. And there is also a CDC, in addition to the CDC system, there's also a CDPH. So just make sure you contact our immunization program staff so that you are aware of the process. Now, just moving on to the next slides, as I close, I just want to remind everyone that our actions can save lives. We want to remind everyone to practice the 3 W's implemented or recommended by CDC. Washing your hands, staying 6 feet apart from others, and then wearing your facial covering. And stay home if you are sick. And we want people to get tested if they're sick. And when it's your turn, from healthcare systems to those individuals that are 75 of age and older, individuals with underlying medical conditions, 65 to 74 years of age. Whatever the category that you're in, when it's your time, we want to make sure that you get tested and information will be provided. So lastly, the best gift you can give your loved ones and our frontline healthcare workers this holiday season is the gift of health. If we don't look out for each other, this virus will remain out of control. So we want you to do us a favor and remain connected with the important people in your lives over the holiday season, even if you cannot physically interact with them. Pick up the phone, your tablet, or your favorite electronic device and wish your family and friends a happy holidays. Be COVID safe, San Diego, and enjoy the holidays, but it is only together that we can forge a brighter new year. So now I'd like to welcome to the podium Chris Van Gorder, who is the president and CEO of Scripps Health. Thank you.
Thank you, Dr. Wooten. I'm here today on behalf of really all the hospitals in San Diego County to just tell you how serious the situation really is. As you're probably aware, up in LA County, they have already run out of ICU beds, and frankly, we're not all that far from it. Last night, as I was preparing my notes, I actually received a note from one of our emergency physicians, and I think, being on the front lines, this message may be more important coming from him than coming from me. He was sending this to one of his bosses. said I wanted to pass along two things, maybe to pass up the food chain. I have been increasingly disheartened this last week when seeing our fellow San Diegans completely disregarding stay-at-home orders. Malls, stores, and restaurants are packed. Yes, people are wearing masks, but more needs to be done. I feel like even my educated neighbors have no idea what it's like and what's going on in our hospital, and I'm sure that all of San Diego hospitals. I feel like most people don't understand that not only are we out of ICU and critical care beds, but we are running out of some equipment as well. I don't think people realize that soon we could be in a situation like Italy or New York City, when all we will be able to offer a critically ill patient will be a nasal cannula oxygen, basically causing numerous individuals that could be saved to needlessly die. I wonder if getting this message out to the public via the news and newspaper would help the public see the gravity of our situation. I feel we are on the precipice of having mass death on our hands, and the same nightmares seen in New York and it could be here in San Diego. I was writing to see if Scripps Corporate can get the message out. I would hope this would help make San Diego realize how severe the situation is, and maybe would help change behavior and save lives. My response to him was that it appears at this point the believers believe, and we fear that many others just don't seem to be heeding the message. And that's why all the hospitals in San Diego County, through the Hospital Association, issued a press release this week out of our concern for the situation here in San Diego. As you noted from the slides earlier, we're already surging, or we're still surging from Thanksgiving, as evidence in our healthcare system of a 22% positive test rate just this last week. And we all know that when you have 22% of the people getting tested, there's going to be a percentage of those individuals in the hospitals within 2 to 3 weeks. And of course, that's Thanksgiving. We still have Christmas and New Year's right ahead of us. As President-elect Biden stated yesterday, he said that the darkest days of COVID are not behind us, they're still ahead of us. And that's what we fear here in San Diego. Let me just give you some history. On July 10th, that was roughly July 10th or 11th, San Diego County had 411 COVID cases in our hospitals. And we felt like we were a little bit out of control back then with 411 cases. And that, by the way, that included many that were transferred here from Imperial County. Those were just not San Diego County residents. As of today, just a few minutes ago, we have 1,492 COVID patients in our hospitals. That's more than 3 times the amount of cases that we had back in July. And right now, in San Diego County, we have 24 staffed ICU beds available. That's out of about 670 ICU beds. 24 left today. Now, patients are coming in and out every day. Those numbers change. But that indicates to me, and I think that others in the healthcare system, that we have a little bit of a dilemma on our hands. Now, let me show you a couple of slides to show you what our predictions are. UCSD has done some analysis with their data scientists. Sharp has done the same thing, and Scripps has done the same thing. And these are numbers that we actually put together over the last 24 hours in collaboration with San Diego County, who shared a lot of data with us as well. So the first slide here is our COVID-19 hospital census prediction. So this is just COVID patients. So right now we have 1,347. We believe we will peak on January 10th at 1,827 patients. Now there's a best case in that red shaded area. The best case would be 1,300, and the worst case up to 2,200 COVID cases. That's, by the way, a 28% increase between now and January 10th. The next slide is the projected COVID-19, just the ICU census. Right now, it's at 336, but we believe it will peak on January 11th at 483 patients. Best case, 344, worst case, 584. And currently, 67% of all of our ICU beds are being held by COVID patients. The next slide. This is the med surge. These are the patients that can be in a little bit of a step down, not in the intensive care unit. Our projections is that we will peak on January 9th at 1,387 patients. Best case, 988. Worst case, 1,675 patients. Next slide is the total hospital census. And this is when the whole hospital gets overwhelmed. Right now, we have 4,439 patients. 30% of those are COVID patients. Our projections are that by January 10th, we will have 5,133 patients. 36% of those will be COVID. Best case, 4,608. Worst case, 5,514. Next slide is the ICU census. Remember I told you we have about 657 staffed beds right now. Right now, on yesterday, there were 582 patients. 58% of those were COVID patients. Our predictions are on January 12th, we will peak with 726 patients, 67% of those COVID. And that will be 108% of our capacity at that point in time. Best case, 587 patients. Worst case, 827 cases. And then our med-surg census, we think we'll peak on January 9th at 3,950 patients. Best case, 3,551. Worst case, 4,238. And that'll be about 35% COVID patients. And the last slide is just the assumptions we used in putting these numbers together. So the reality is we're facing a significant situation here with our capacity. And it's made worse because back in summer, the spring and summer, it was a regional situation, not a national situation. So back then, we could get traveling nurses, we could get registry nurses, we could hire more nurses locally. Today, this is a national situation, and we cannot recruit travelers, we cannot recruit registry nurses, and unfortunately, a number of our healthcare providers are also getting sick. They, just like everybody else, had holidays and are out in the community with this high community spread. And we have a significant number of our healthcare workers that are testing positive every week, and that reduces the amount of staff that we have. So it's not a bed issue that we have, it's a staff issue. That's the most significant issue we have. So what's our response? Well, first of all your hospitals in this community are working together. I've never seen such great collaboration between the hospitals, the Healthcare Association, the County of San Diego. We have stopped elective surgeries, and we're only doing really time-critical cases. These are cases that cannot be postponed. Emergency surgeries, cancer surgeries, a variety of surgeries that you can't postpone. But everything that we could postpone, we've postponed. We are using surge plans to increase our capacity. So we're actually, we have opened our third COVID unit up at Scripps Encinitas. And today at Scripps Encinitas alone, they were at 183% of their ICU capacity, surging out well beyond their traditional ICU. We are using engineers to expand negative pressure capacity so that we can admit more patients in a secure environment. We're using team nursing. So normally we would operate under staffing ratios, but the state of California has given us waivers because we wouldn't be able to even admit patients if we didn't have the waivers. And we're using a concept called team nursing to expand the use of nurses and support the nurses in their care. We're load balancing. We're continually transferring patients from one location to another. So just last night, we transferred 8 patients from Chula Vista, Scripps Chula Vista, to hospitals in the north that had some bed capacity. So we're maximizing the use of the beds in the community. We are recruiting, but few resources are available. We are buying more equipment. We are buying more ventilators. We are buying more supplies. We're buying more PPE, and the County of San Diego has been great in terms of supporting us as well. And really, the best news we've had in a long time, we are vaccinating our staff. And literally, we are having doctors and nurses crying when they get their vaccine. So we know how important that is, and if we can provide for their health, they'll be able to provide health to you later on. And lastly, we are working on our crisis care protocols. And this is the care we would take care of patients when we actually run out of capacity completely and we're unable to take care of patients in the ICU where they belong or in med-surg where they belong. There's a whole process that was developed by the state of California. Our healthcare system, the other healthcare systems have drilled in this just in case it was necessary to implement, and we're ready to implement that if absolutely necessary. So our ask is very simple. Given what we're seeing, it may be a little bit too late, but we're asking you over the holidays to certainly enjoy the holidays. But stay within your immediate family for the holidays. Most of the cases we are seeing now relate to Thanksgiving gatherings, and gatherings together, unfortunately, in stores and businesses where people got together too closely. Wear a mask. Wear at least a 3-ply cloth mask or better. Distance yourself more than 6 feet, or even further if you're going to remove your mask to eat or drink. Celebrate outside if you can, and certainly wash your hands. And if you travel, because we know that people are going to travel no matter what we say, drive if you can, wear masks, Quarantine yourself when you return home if you can for 7 to 10 days. And that way, even if you're infected, perhaps you will not infect others in the community or in your own family. So we do have a light at the end of the tunnel. While it's a little bit grim, the message I have to share, we are in the holidays. We hope for the best. We have a vaccine now. And we're running right now a marathon. And we're at the point where you're at the 20-mile mark and we're hitting the wall. And people have pandemic fatigue. They're tired of all of this. I can tell you the healthcare workers are tired about this. But we got 6 miles to go. We got this vaccine that we're going to be giving our community this next year, and there is a light at the end of the tunnel. Let's not give up now. Let's be focused on what we need to take care of our community and to take care of our healthcare delivery system. Thank you very much. Have a happy holiday. And I will turn this over to Chairman Cox.
Thank you, Chris, and thank you for all the great work that you're doing at Scrip, along with our other tremendous hospitals in this region. They're really working together like you could never ask them to do better than what they're doing right now in the coordination. Let's go ahead and get right to the questions. First one.
First one is from Mimi Alcala with ABC 10 News.
Supervisor Fletcher said the federal medical station situation is still developing, but can you provide any more information about how the 202 beds will be staffed and how soon it could possibly open to patients?
Okay, Supervisor Fletcher will respond.
Yeah, we can't. We know the governor announced it's opening. We would direct you to the state of California, to Palomar. They may have more information, but again, it's a work in progress and a developing situation. So as we get more information, we'll be sure and share it with you.
Thank you.
Next question.
The next question is from Alexis Rivas from NBC 7.
So business owners say they're not taking you seriously anymore, that there's just too much back and forth, and despite the money they say they've spent to be safe, they say you're not proving to them they are the problem, and their businesses are dying. So what do you say to those business owners?
Supervisor Fletcher is going to respond.
Well, I think we understand people's frustration. Reason some of the restrictions go back and forth is because the virus goes back and forth. When we see a surge in cases, we have to see a surge in the actions that we take to avoid it. We also know it's difficult. There's a lot of misinformation that gets put out there. There's a lot of public officials, a lot of elected officials encouraging people to defy the public health orders. There's a litany of misinformation that gets shared out there. All we can do every day is get up and put in place systems that are designed to protect our region, designed to save life, designed to guide us as best we can out here. We can have enforcement teams and all of the types of things we do to try and navigate it through. But ultimately, each and every San Diegan is going to make an independent decision and choice about their commitment to one another and their willingness to partner with us, to trust public health and science. We can share all the studies about the spread and show all the numbers about the dangers of gatherings in indoor places and all of these types of things. But really where we are now, 10 months into this, is people have to make a decision to look at the cases, look at the impact in the hospitals, look at what's happening around the country, and make a decision that out of a sense of community, we are going to come together and we're going to tackle this. We're going to get through this difficult period and we're going to come out of it. And so we continue to hope that the vast majority of folks will find that approach.
Next question.
Next question is from Matt Hoffman with KPBS.
Hi, guys. As we head into Christmas 2020, you guys mentioned 24 ICU beds in our county that are staffed. Can you put that in perspective, like what that means for our county with more than 3 million people? Like, does that mean if you have a serious accident this Christmas, the critical care bed might not be available? Or?
Okay, I think Chris Van Gorder is going to respond to that.
Yeah, it's a serious situation when you're down to 24 beds. Now, patients are being admitted and discharged every day. So just to give you an example, in our healthcare system, we had 62 COVID patients admitted just in the last 24 hours, and we discharged about 44 of them, and unfortunately several died as well. So we're also expanding beyond our traditional ICU beds. So for example, Scripps La Jolla is opening a closed surgical intensive care unit to add beds. Now, we have two issues, though. One is adding the physical beds and making sure that the monitors and the equipment is there, and the other thing is the staffing. Staffing right now is the biggest concern we have, and so we are using team nursing, and we'll pull in as many resources as we can. One way or the other, we'll find a place to put you in the hospital, but as we get full, as we stretch our resources, the care may have to change, and that's where crisis care comes in. And we're hoping we can avoid that and that everybody gets the traditional care that they need to have. But we are at a point where we're maxing out our ICU capacity. We're stretching our staff well beyond normal times. And so what we're asking for is everybody to really buckle down, follow these guidelines so that we don't end up in the worst case scenario that we pointed up there that could put us well beyond our ability to take care of the patients.
And Chris, when you talk about that worst case scenario, like how real is that for you? Is that something that keeps you like awake every night, or sort of how does that into your daily?
I haven't slept in 9 months. No, it does. It really worries us. It worries our providers. That's why this emergency room physician sent the note out last night, basically pleading for the public to pay attention to the guidelines. We know people are hurting out there, and we know they're tired of the pandemic. You know what? We're damn tired of it too. But we're the ones that end up getting those patients that are desperately trying to catch their breath, that end up on a ventilator or end up on an ECMO machine. And that's the worst case scenario for us, and it's the worst case scenario for them. And if we really all concentrate as a community, follow these guidelines, stay at home this year. There's 300,000 people that are going to have a chair missing this year at their holiday dinner. It would be better to maybe miss them this year so that they have a chair they can sit in next year.
And then just a quick one for county officials. I know the governor named a number of states, including that one, or a number of surge facilities, including that one in Escondido. Are you guys looking at opening up any other ones, like a sports arena or something, for example?
Matt, in general, the problem is not the structures, right? We need structures, you need stuff, you need staff. And so we could open up a lot of structures. We could perhaps find the stuff. The real problem is the staffing. And this is where you are dependent upon state or federal entities that might have staffing that could come with it. We're going to continue to push to do everything we can to get every person or body that we possibly can. But this is a national shortage of in particular, nurses. And so, you can open all the buildings in the world, but again, you could have beds in a facility today. The real problem is staffing. And so we're going to continue to fight to get everything we can from every entity that's out there. Our hospitals are going to continue doing everything that they're doing. But it is a national problem that can't just be solved by having buildings.
Thank you.
Okay, next question.
The next question is from Brandon Lewis with 8 News.
Thank you. I have two questions to ask. The first is about the UK strain. If it appears in San Diego County, could that prompt any changes to the health officer's order, or do you believe the current rules would suffice? Also on the vaccine side, Dr. Wooten has previously explained that someone doesn't just get the vaccine. So can you take us through the specific steps that are taken to track somebody who gets the vaccine, such as how they register with the state, how it's monitored, et cetera, please?
Okay, Dr. Wooten's going to respond.
So thank you for those questions. There's a lot of questions there. I will start with the first one, which is the state. Providers have to register with the COVID Ready, which is what I talked about earlier. Once, and we don't anticipate that there will be vaccines available for the general public probably until early spring. So, but we want people to pay attention. We will be announcing it this way. Providers will be informing if individuals have healthcare insurance. Their providers will be letting them know, but we will be letting you know that vaccine is available at providers for vaccination. Regarding the UK strain, it is very common for viruses to mutate. We call them either a shift, which is mild, or a drift or a shift. And there are multiple different types of strains even circulating in San Diego, but to date, the UK strain is not currently been identified in San Diego. And I say to date, because we all know that with people traveling, it is only a matter of time before that happens. And
Thank you. If I could just, sorry, go ahead.
no, I was going to ask, was there another question?
Maybe if I just rephrase the first about when you get the vaccine, when a provider, nurse, a doctor, someone gets that vaccine, though, can you take us through, though, how they're registered? And specifically,
Yes.
I know there's concerns about, people trying to skip the line, perhaps. And so that's why I'm asking, like, how it's tracked so that providers even, are on track so that they know who got the vaccine and when they got the vaccine.
Well, in San Diego, we are very lucky to have our own vaccination registry. It's called the San Diego Immunization Registry. And we've had a lot of experience tracking individuals that have to get 2 doses of a vaccine series. When we had our hepatitis A outbreak and also with the meningococcal group B outbreak at San Diego State. So we can basically look at individuals that have been vaccinated. Providers, when they vaccinate, have to register that vaccination in our San Diego County Immunization Registry. Now, and you've heard how many vaccines are in the region. With the vaccines being given to our local providers, you're not gonna see all of those vaccinations in the SDIR, because remember, we don't want our providers to all have any of the minimal side effects. So healthcare systems are vaccinating their providers kind of in phases. So we should not expect to see all 100,000+ vaccines that have been received into the region in the registry as of yet. But so we will be rolling out a process where we will be reporting and having that information on our webpage that shows how vaccinations are going in San Diego. Does that explain?
Thank you, Dr. Wu.
Thank you.
Yes, it does. Thank you.
Okay, we have one last call-in question.
This last question is from Paul Sisson with the San Diego Union Tribune.
Thank you for taking my call. I had a question about the modeling that was presented in today's briefing. I wonder, do modelers project that care rationing would be required in either the predicted scenario or the worst case scenario or the best scenario? And which of those scenarios do you think care rationing is going to be required in San Diego County?
Okay, let me ask Chris Van Corder to come up from Scripps Health to respond to that.
Hi, Paul. I don't know that we factored in, I'd have to go back to the data scientists, but factored in what different kind of tier rationing would be. I think it's been based upon what we saw back in the summer and how it's evolved a little bit, but I don't think we factored in different levels of tiering. So, but I think within the low and the high, I think that probably factors in all of the potential scenarios that you'd have there, which is why obviously we projected that middle point is and the dates that we have. Does that help answer the question?
I wasn't asking so much about tiering as just the idea that, you know, in the worst case scenario where you have projected an X number of cases in a certain amount of time, would that number of cases force local hospitals to get into a triage situation where they're deciding who gets an ICU bed and who has to go without?
Yeah, okay.
Triage scenario that's in the crisis care model.
Yeah, no, I misunderstood your question. We're to some degree, we're already in that scenario. Where now a patient that maybe we would have kept in the hospital a little bit longer, we might be able to discharge to skilled nursing or something like that a little bit earlier if we can. We'll make a choice between the patient that may be out on high flow oxygen, maybe originally would have been in the intensive care unit, now may be treated in a medical surgical unit. So those kind of decisions are probably already being made because the ICU capacity is so tight. It just gets worse as we go on and staffing gets tighter. But we'll have to make those kinds of decisions, and that is part of where the crisis care comes in, so that We have triage teams that will help support the frontline doctor in making these difficult decisions that will have to be made if the resources, the beds, the equipment. Classic example might be ECMO. Today at Scripps, we have 8 ECMO machines and 7 are in use. Well, if we end up with 2 or 3 patients that could be on ECMO, we're going to have to make a clinical decision if we can't get another hospital system that has it in the community. If we run out, there's going to have to be a clinical decision made on who stays on ECMO and who doesn't. So that's how the system works.
And then I wonder also if we could unpack this term staffed beds. It's been getting used a lot lately, and we've been, told that we're down to a certain number of staffed beds for a few weeks now, and it's always a very low number. But it seems like the term staffed is a little bit in flux right now. As you're opening additional surge beds in various areas, and as you're going to a different model of team nursing, what does that word staffed mean now versus what it meant 2 or 3 weeks ago?
It means exactly what it says. If we add beds and we can stretch our staffing, we will consider that a staff bed where we can put a patient in the bed. And that's very different from a licensed bed where if we don't have staff, even we're not going to put a patient in the bed if we're not going to be able to care for them with the staff, physicians, hospitalists, nurses, and others. So we're having to stretch now beyond the traditional nurse-staff ratios to this team nursing. And again, that right now, using team nursing, this is the number of beds we have available to take care of the patients.
So when you use the word staffed, you're not saying staffed and meeting nursing ratios. You're saying staffed any way we can manage.
That is correct. Right.
Thank you.
Yep.
That completes our call-in questions. We do have 2 texted questions. The first one is dealing with church services, and Supervisor Nathan Fletcher is going to respond to that.
This question is from Jacqueline Sarkissian with Fox 5. She wants to know what the county has to say about churches, especially ones where outbreaks have already occurred, that are still planning to hold Christmas services indoors. Also, the court denied the request to allow indoor services like what happened in Los Angeles County. Does San Diego plan on changing its ban at all?
Yeah, as we've said multiple times, we recognize the foundational role of faith and religion in our community, especially in difficult times, the constitutionally protected nature of it as well, which is why under the public health orders, religious services are allowed to meet in numbers that are not allowed for any other entity in terms of unlimited number of outdoor gatherings. Again, recognizing the importance of it and the constitutional protected nature of it. And the court recently recognized that in their ruling, where they outlined both why it is allowed to do things that other entities are not allowed to do, but also recognizing the extreme danger that is presented from indoor settings with large number of people for high intensity of duration and exposure, particularly in settings where people are singing and speaking and being with one another. And so the court again validated the approach that we've taken, which is a difficult step and it is a tough balancing act. And so we continue to warn the public about the dangers of indoor religious services, or frankly, indoor anything where people are exposed to one another for long periods of time. There is a difference between passing someone in the aisle in a grocery store with both of you wearing a mask versus sitting next to someone for an hour and a half in a different environment. And so we continue to advise against that, and we'll continue to work as best we can to enforce it. And we do appreciate the court's validation of that approach and effort, and we plan to continue with our current approach.
And Supervisor Fletcher, there's a second text question from Mike McKinnon. This one is a question from KOSI. California has the strictest regulations in the country. Why is our situation so much worse than in states with little restrictions like Florida and Texas?
Thank you for that question. KUSI News may not be aware of this, but California has twice as many people as Florida has. So it is not a fair comparison in terms of the number of cases. I would point you to the Tampa Bay Times, a publication in Florida, which recently did an analysis, and they showed that per person, Florida has more COVID cases than California. Per person, Florida has more COVID hospitalizations than California, and per person, Florida has more COVID deaths than California. And so I'm not sure that highlighting Florida as a model of what we ought to do necessarily makes a very strong argument. Thank you.
Thank you, Supervisor Fletcher.
We have one more text question that just came in regarding the reopening of schools in the San Diego Union School District, and Dr. Wooten is going to respond.
And this one is from Brandon Lewis with Channel 8 News. San Diego School District plans to reopen classes in January. Is it permitted to reopen under the health officer's order, and how is it working with the district?
Thank you for that question and the opportunity to clarify. While jurisdictions are in the stay-at-home order, the state will be issuing guidance for whether or not schools can open if they are not open. I think the guidance so far is that if they are open, they can continue to be open, but if they are not, it depends upon the case rate. But that guidance should be coming out soon, and whether it's San Diego or any other school district, all school districts will have to abide by and follow the California guidance for schools when it comes out. So we will look forward to getting that information.
Well, that completes our calls for today. Again, we certainly hope everybody enjoys the Christmas holiday, but we also please ask you to do it safely. We will be meeting again here next Wednesday at 2:30 for the final press conference of the year. Until then, protect yourself, protect your family, wear those face masks, maintain that social distance, wash your hands, but also have a happy holiday season.